The quality of care that these patients receive is as good as they can get anywhere.
We see an assortment of patients. Primarily, we see 3 big diseases that have a major impact on the health of those people and the community around them. High blood pressure, diabetes, and chronic obstructive pulmonary disease. Those 3 diseases account for a significant amount of the illness in our community, and they have a rollover. For example, diabetes and hypertension have a major role in creating heart disease. So you control those, you cut down the incidence and severity of heart disease.
When I go to the clinic, it's the nurses, the doctors, they're very nice. They're always there if you need something. Dr. Menifee got my insulin, where it needed to be, and he pretty much saved my life, so.
I've been employed with a company for going on 20th anniversary, going on 20 years, and the company cut back this past June, made 2 years that the company cut back to the point where I was working part-time, when I'd lost all my benefits and my insurance. Because of Alabama Free Clinic, I now have access to a doctor. I now have access to my 4 prescriptions that I have to take daily. Without that, my treatment regimen would not exist. It's just that simple. I can only do so much on my own.
Alabama Free Clinic, when I went there, I was in a wheelchair. And at that time, I had no help with my insurance, nor meds. And they helped me to get meds, and as well to get to doctors to monitor me while I take those meds. And with the blood pressure and the diabetes.
A lot of people in South Alabama have diabetes. I think it's in the top 3 states as far as the incidence of diabetes. And it's just a much higher incidence in the lower socioeconomic brackets. And so we see a lot of people with diabetes.
These people, they don't have much. They may be working and they don't have enough money to pay for their health insurance. They may be sick and they don't have the funding to go and get health care because they may need to feed their children. They may need to pay their power bill. They need you.
We had a patient come into our clinic who had a major problem with vision because of a cataract. Well, we don't have facilities in this clinic to take care of cataracts. However, one of the ophthalmologists in our community, at our request, agreed to see this person. We partner with people all through the healthcare community, certainly with the hospitals, but also with a lot of physicians. Our nurses are very good at this. If we have somebody that has a problem we can't take care of here, we can make the referral out into the community at our request at no charge.
We had a patient who had diabetes, but they were pretty much well controlled, but he ended up having to have an abdomen ultrasound, and through that ultrasound it showed that there were some calcifications in his heart. So we got him a cardiac consult, he had a stress test, and he ended up having to have emergency open heart surgery. And anyway, he is okay today, and he is so grateful and thankful for everything we've done for him.
The girls there and the doctors checks me. Not only that, they make sure I get all of the treatments that women should supposed to have.
We formed a unique relationship with the Baldwin County Health Department. The Baldwin County Health Department had an office space, exam room set up, and actually had a formulary for treating hypertension. What they did not have were physicians and nurses. So we brought physicians and nurses and clerks. Our partnership with both Thomas and North Baldwin Infirmary is really a mutual benefit partnership. We get lab and x-ray services. In return, they should be having fewer emergency room visits. The clinic needs to raise money to, first of all, to pay for our full-time employees. We have a clinic director, we have a clinic coordinator, and we have some professional staff nurses that work part-time. Because of our use of an electronic health record, the nurse who actually works with the doctor in the clinic has to be trained in this technology, and that's really, for practical purposes, has to be available at every clinic. Other things we have made investments in, which required money, are our electronic health record, our devices for measuring blood sugar, ECG machine. Given the work that we do, our budget relative to what we do is actually fairly low. We calculate a return on investment that is based on costing out the physician's time, the nurse's time, the pharmaceuticals that we provide through compassionate use.
What's important to understand is that the care we provide to a patient in this clinic has a waterfall effect downstream. It keeps them at work, helps them, they're employed, helps their family, keeps them well, keeps them out of the hospital emergency rooms. So, the primary focus is on that person in the clinic, but the expansive benefits of that are tremendous.
We need physicians to come to Alabama Free Clinic and take care of patients that really need you. We need physicians to come make a difference.
If you are a healthcare provider and you got into that field because of the goal of helping people, which most of us did, and you want to get past the stuff, and that's a nice word I can say, the stuff that interferes with your ability to really take care of people, this is a great place.
There's an atmosphere of true caring and concern and compassion, and the patients can truly sense that from the moment that they walk into the building. My wife has even found a job at the front desk working as a receptionist, so we work as a team the night that we come.
You do what you were trained to do. You do what you've always wanted to do, knowing that many of them, without us, are not going to get the care they need.
These are patients that fall between the cracks. They do not qualify for Medicaid, they do not qualify for Medicare, they cannot afford insurance, and most of these patients are hard-working people. And they deserve the same quality of medical care that all of us do. The quality of care that these patients receive is as good as they can get anywhere.
It would be hard without the Alabama Free Clinic because I don't know how I would get my medication, and I need to take care of my children. I need my health to stay good. I really don't know what I would do. It would be very hard.
And it's a lifeline to me. It truly is a lifeline. And I don't know what I would do without them.
I appreciate your time and your commitment. That means the world to me. It's an invaluable thing to have access to. Thank you, Alabama Free Clinic.